Good morning, everyone. Thank you so much for joining us today. We're going to go ahead and get started. My name is Amanda Kelly Thompson. I'm the Director of Advancement at NAMI Delaware, and I will be moderating today's presentation. We want you to know that you are not alone. This is a difficult time for many of us, and what we talk about today may generate some strong feelings in you that you don't expect. So it's important to know that you can access crisis support 24/7, no matter where you are. For the National Crisis Text Line, you can text DE to 741-741, or you can access the Delaware Hope Line by calling 1-833-9-HOPE-DE, or by texting DE Hope 55753. I'd like to now go ahead and introduce our presenter. Dr. James Ellison trained to be a psychiatrist at the Mass General Hospital, then worked as a general and geriatric psychiatrist in or near Boston. He also has a master's degree in public health from Harvard. He has developed clinical programs and educated his peers and public in multiple settings. His clinical specialties include the assessment and treatment of neurocognitive disorders and mood disorders in older adults. He is a researcher, the editor-in-chief of the Journal of Geriatric Psychiatry and Neurology, and the author or editor of several books and multiple peer-reviewed articles. Dr. Ellison moved to Delaware in 2015 as the first Swank Foundation endowed chair in memory care and geriatrics. In this role, he works to improve the care of older adults by increasing their access to state-of-the-art diagnostic tools, clinical assessment and treatment approaches, caregiver support resources, and research trials. This presentation will have a question and answer session at the end, so please type any questions or comments you have in the chat box, and we will try to answer as many as possible. I will now turn it over to Dr. Ellison.
Okay, good morning. I want to make sure that you can see my slides. Amanda, are my slides on the screen?
Yes, they are.
Great. Thank you for that nice introduction. And the good news about this presentation is that it has a very positive message. It's all about what we can do to promote healthy aging and cognitive health. One of the most important points that I try to stress with our patients at the Swank Memory Care Center where I work and in geriatrics in general is that there's a lot that we can do. The World Health Organization says that maybe 40% of cases of dementia can be delayed or prevented by healthy lifestyle. So I'm going to talk with you about cognitive aging and brain healthy living and present to you an organized way to think about this problem. Now let's see, I'm going to see if I can change my slides here and show you, first of all, that I have no financial relationships to disclose, and I'm not going to talk much about medications, so I won't be discussing off-label use of medication. Let's start this discussion by considering the definition of cognition. I run a memory disorders clinic, but truthfully, the patients that we see have problems that go beyond memory. Memory is only one of a number of areas that the brain uses in order to survive in the world and problem solve, negotiate visual, spatial relationships among things, deal with people, understand nonverbal behavior, etc. We have to pay attention to multiple things going on around us at the same time. That's called complex attention, or we think about it as multitasking. We have to understand what people are saying to us and be able to formulate a reasonable sentence ourselves to communicate with others. We have to master all of these areas of cognition, and any one of them can be affected, and often more than one is affected by cognitive aging. We often say in geriatrics that after age 50, lifestyle makes us age very differently one from another. You know people who are 60 or 70 years old who are fit, active, and enjoying life. And you also know people who have aged in a way that's less respectful of their autonomy, and they're having a harder time getting along, maybe because of the long-term effects of physical illness or lifestyle decisions, smoking, alcohol, and so on. Some faculties improve with aging. We look to our older members of society. For example, think about our presidential election. We're looking now at the two oldest potential presidents that our country has ever seen, 74 and 78, I think, who will be 78 and 82 when they finish office. People can function well into their 70s and 80s and beyond. And aging helps with the faculties of resilience, stress tolerance, compassionate understanding of others. And we put these all together and we talk about the wisdom of older people, which relies in part on what we call crystallized intelligence. That's the ability to compare the present situation to something that's been our experience in the past. And we know what worked and what didn't work in the past, so we can make good judgments about the present. Fluid intelligence, which is dealing with new things, that's something that doesn't do as well with aging. And other things that suffer with aging include processing speed. We think of older adults as functioning a bit more slowly. It takes them longer to learn new things and to process new information. And working memory, that's the capacity to keep multiple things in mind. You look up two phone numbers and you go to the phone, and by the time you finish the first call, the second number has to be looked up again. That's working memory. Or I'm going to, make a phone call, and then I'm going to fill out a form, and then I'm going to go shopping for a list of things. That's working memory that keeps a bunch of things in mind and processes that information. That doesn't do so well with aging as well. Inhibitory control, or the ability to suppress, bite your tongue, not say the thing that might irritate somebody else. That's not as active in older adults. And I always like to talk about sensory perception because that's so remediable. Problems with vision or with hearing make a person more remote and withdrawn and less involved in social interactions. And they're even thought now to contribute to cognitive decline. Now, when we talk about cognitive decline, we can think about it as on a spectrum from the super normal people who don't show any effects of aging, just get better and better, to the people who are more typical and have some difficulties, to people who have what we call subjective memory impairment or subjective cognitive decline. You feel like maybe there are days where you're slower than you should be, but the testing doesn't show anything wrong. And then there's the first condition that we think of as a real disorder. That's called mild neurocognitive disorder or mild cognitive impairment. People with mild cognitive impairment often stay the same. Some of them even get better, but a certain number of them, maybe 12 to 15% per year, progress to dementia. The way that you can recognize somebody with mild cognitive impairment is that they function okay, but it takes them longer and it takes more work. They have to rely on lists, reminders, and they might have more trouble doing simple things, or more complex things are going to present some real difficulties. They might need more help doing their taxes, learning new computer programs, things like that. And then dementia is the more severe form of cognitive impairment. We're not going to talk so much about that today, but that's when a person has to lose independence because they can no longer take care of their more basic needs. We all know people with dementia because in Delaware alone, there are 19,000 people with dementia, and many of them have behavioral issues as well. So they're familiar to us both for their cognitive and behavioral difficulties. Some of them have to live in long-term care, but many of them live at home, cared for by family members and other kinds of helpers. Now, this is a confusing slide, so I'm going to show you what it means and walk you through it. On the y-axis, we see standardized change measures, and on the x-axis, we see years from symptom onset. And this 0 here is the point at which a person was diagnosed with dementia. This is 30 years earlier And we're looking at what we call biomarkers, or measurable biological chemicals, for example, or changes in neuroimaging that help us understand that there's a disease process going on 30 years before dementia that we can measure. So here's cerebrospinal fluid, or spinal fluid, beta amyloid 42. That's a protein that we associate with Alzheimer's disease. And what you can see is in the people who developed Alzheimer's disease 30 years later, already we could measure an abnormal level of this protein. That turns out to be important for early diagnosis for research studies. But the reason I'm mentioning it today, along with these other things, hippocampal volume, cerebrospinal fluid tau protein, and glucose metabolism in the brain, is that I want to make the point that dementia or cognitive decline is not something that comes on suddenly. It has a run-in period of decades. And that's good news, because what it tells us is we have an opportunity to do something about it. We can intervene and change the course of the future for many people. Now, I like to talk about what I call the dancer model. Whoops. And I'm going to see if I can show you my slide. It looks like for some reason I just have lost my slide. So I'm going to come back to it here. Okay, good. Sorry about that. Now, this is the dancer model. And what I talk about is disease management, physical activity, good diet or nutrition, cognitive stimulation, social engagement, relaxation, and successful sleep. I'm going to talk a little bit about each of these things because each one is so important, and together they have a very beneficial effect on aging. So first, let's talk about disease management. Do you know that about 25 to 35% of older adults have diabetes? About a similar number or more like 60% have high blood pressure, 30% have obesity. Many people are physically inactive. A large number of people smoke, and hearing loss is very important. These are all disease processes that were identified by the World Health Organization as important antecedents to cognitive decline. Let's talk about the easiest one to deal with first, which is smoking. In 2017, 14% of American adults were smoking cigarettes, and many people were living with smoking-related diseases. Now you can see that among the 65 and older population, there are fewer smokers, but that's not necessarily good news. What that probably means in this graph is that between 45 and 64, smoking-related diseases killed a lot of people. That's a problem with smoking. We recommend that people do not smoke. That is very important for cognitive aging because especially people who have a genetic predisposition, their brains age more quickly if they're also smoking. But for anybody, these are a serious cause of disease. Next, let's talk about blood pressure. And that affects, you can see, about 60 to 80% of men, and here 70 to 80% of women in this particular study. But the point is 60 to 80% or more of older adults have high blood pressure. Well, the reason that's important is because the brain depends very heavily on the blood that comes to it, bringing it oxygen. And when you have high blood pressure, it interferes with the regulation of delivery of nutrients, oxygen, blood to the brain, and interferes with cognitive aging. There is evidence that if we treat high blood pressure in midlife, in the 40s, 50s, and 60s, cognition will be less likely to decline in the 70s and 80s. Now, we talk about Alzheimer's disease as the most common dementia, but almost as common is vascular cognitive decline or vascular dementia, which is caused by the changes from high blood pressure and other vascular risk factors that can be addressed. There was a study that showed that only about half of people in the United States with high blood pressure were adequately controlled. You can see that over age 60, 54% had adequate control of their blood pressure. And that's really a sad story because we have the good medicines and the measurement devices and the expertise to treat people with high blood pressure better. A study called the Sprint Mind Study published information in 2018 with almost 10,000 people in their 60s and older, and showed that after 5 years of following them, if their blood pressure was lowered to systolic blood pressure below 120 instead of 140, 15% fewer people develop mild cognitive impairment or dementia. So there is currently a very important study going on. It's a 5-year study in the United States called the US Pointer Study, which is following up some of these findings and seeing whether diet and exercise and other lifestyle interventions can reduce the rate of dementia. What about cholesterol? We always hear about the importance of lowering high blood lipids like cholesterol and triglycerides. And hyperlipidemia or high blood fats is very common in the United States, nearly 40% in men and women over age 75, 35 to 40%. We know that if we treat dyslipidemia or hyperlipidemia or high cholesterol in midlife, we see a better result later on. Especially this is true with people who have genetic predisposition, what's called the apolipoprotein E epsilon 4 genotype. That's a mouthful, but what it means is that about 30% of the population carry a gene, which is found in about 60% of people with dementia. So it confers a significant risk if you have that gene. It's not all or nothing kind of a phenomenon. If you have the gene, you don't develop dementia necessarily. And if you don't have the gene, you still can develop it. But it increases your risk, and especially if you have high blood pressure, high blood fats, head injuries, and some other things. Smoking as well, and alcohol for that matter. Okay, so we want to treat diabetes as well, which affects the blood vessels of the brain. And many people are not treated adequately for diabetes. And then also one of the very important causes of dementia in younger folks is alcohol. And here you can see, this is kind of a confusing looking graph, but it's pretty. So I wanted to include it and explain it. You can see that alcohol-related brain damage is a very, very common cause of dementia. And this is both in men and in women. Here you can see men on one side and women on the other side. And starting in the 60s, other kinds of dementia become more important. But in the 50s especially, alcohol-related dementia, very common. Next, let's talk about activity. And I choose the word activity intentionally rather than say exercise, because sitting at a desk all day and getting up for 30 minutes to run on a treadmill is not as good as leading a generally more active lifestyle. Working in the garden, walking when you might otherwise drive your car, bicycling, taking the stairs instead of the elevator. If you can do that, it's very good for you. Physical exercise is important too. And as we get older, we think about stretching and flexibility, strength training, balance training, and also aerobic exercise. One of the problems is we all sit too much in front of the screen. We're doing it now, but it's for a good purpose. And this was a study that showed that computer use outside work increased steadily from the early 2000s. And by 2015-16, almost 1 in 5 people were spending 3 hours of extra time using a computer outside of work. I'm not innocent, but I think that it's something we all need to think about and balance with activity and exercise. Exercise improves so many things about metabolic functioning that it's a whole workshop in itself. But what I'll mention here is it improves fats, blood pressure, energy metabolism, and insulin sensitivity, so it reduces the risk of diabetes. It improves balance and reduces fall risk. Neurogenesis is the creation of new brain cells, which happens more when we're exercising. And proteins that are thought to cause Alzheimer's disease are made less and deposited less in the brain when we exercise. Also, exercise is an antidepressant on a par with our pharmacologic antidepressants. Some people respond with exercise alone in depression, and the combination of exercise with an antidepressant makes it more effective. This is what they call a meta-analysis. And what you can see here is that number one, that's the flip of a coin says that exercise is, if this diamond, which is a sum measure of all of these different studies, were at 1, it would say that exercising or not exercising are equally good. This is a meta-analysis of many studies that look at the relationship between physical activity and dementia. And it shows that the diamond is closer to 0, meaning there's a small but significant benefit in preventing dementia. And we can even see a stronger effect in reducing cognitive decline. Exercise reduces dementia, it reduces cognitive decline. And this is a very important study, which shows that people with lower physical activity who also have the evidence of beta amyloid protein in their brain, so they have that biomarker of later Alzheimer's disease, without activity, they decline faster. Activity is protective. So if you are at risk for dementia, activity is one of the things that can keep you healthy. Very important. It's better than any medicine we have so far. Now, there are studies that also look at prescribing exercise as though it were a medicine. And they show that aerobic exercise improves speed of processing, problem solving, or executive function. Less so for memory, but these other things can assist memory. And even after a person has developed memory complaints, activity can really help. It can improve a number of tests of memory. Even one of the interesting things that's been found is that exercise in people with dementia can improve behavior. So if you're a caregiver of somebody who's suffering from Alzheimer's disease and they sundown or get agitated, or they have depression or confusion, this can be helped with exercise. Okay. Now, how much should we exercise? Well, we should probably exercise at least 3 to 5 days per week, 30 minutes per day, and more is better. And unfortunately, this won't be a surprise to you, that we all think we exercise more than we really do. In this particular study, people were asked how much they exercise, but at the same time, you know, as I guess it was Reagan who said, trust but verify. This was the answer that we trusted, how active they said they were. This was the self-report, and this was the verification, which was the actigraphy. And what we learned from this study was that, except in this very small group of people, people who said they were active were actually less active than the actigraphy showed. And people who said they were inactive were actually less, they were more inactive than actigraphy showed. So basically, we're not doing terribly well with exercise, and only less than 10% of people 75 and older meet the FDA guidelines for suggested physical activity. One of my teachers used to say, what's the biggest room in the world? And the answer was the room for improvement. And that is what we have lots of with activity. I focused a lot here on activity for obvious reason. It's cheap, available, and effective, more than anything else I'm going to talk about. But there are some other things too. So the next thing I'm going to talk about is nutrition. Brain health is definitely affected by diet. In our typical Western diet, which mostly focuses on too many calories, but also fatty foods and dairy foods and sugary foods that are high in saturated fats, carbohydrates, and low in fiber and antioxidants put us at risk for chronic inflammation and obesity. The metabolic syndrome, which is a syndrome of obesity and some medical diseases, is now almost 1 in 3 US adults. It's very unfortunate and something we need to pay attention to. In Rotterdam, a study of over 4,000 people showed that people with better diet quality had larger brains, larger gray matter, larger white matter, and larger hippocampi. The hippocampal part of the brain is very important in memory. So in other words, if you want a big brain, fewer calories, less fat. We talk about the Mediterranean diet, named after, of course, the diet that in Italy and surrounding countries is very popular, which uses olive oil as a main dietary fat instead of butter, and focuses on fresh fruits and vegetables, fish rather than red meat, and avoids sweets and saturated fats. Another approach is what's called the MIND diet, very similar. It identifies healthy and unhealthy food groups, similar to the Mediterranean diet. If we look at a longitudinal study of people who were on the MIND diet, those people who reported low adherence to the MIND diet had a bigger drop over 10 years in cognitive functioning than people who stuck with the MIND diet over a period of years. They aged less cognitively. Very important finding. So what do we recommend about diet? Well, less calories, less unhealthy fats, and think about eating like the Mediterranean diet or the MIND diet, because it's reduced the risk of cognitive decline in large studies and observational measures. Down here, this is just looks a little confusing, increased leukocyte telomere length. There's a special measure of a protein called a telomere in the white blood cells or leukocytes that's associated with longevity. And what this study indicated is that probably people who eat this healthier Mediterranean or MIND diet can expect to live longer, not just sharper, but also longer. Very important. Now, as a doctor, I often hear the question, well, what vitamin or pill can I take? Should I take a jellyfish extract? Should I take a focus vitamin? Should I take vitamin B12 or E or D? Will that make me sharper and help me survive better? And the answer is, if you have a vitamin deficiency, it's very important. Vitamins are essential compounds for life that our bodies don't make. So for example, we wouldn't call it a vitamin if we could produce it ourselves, like a neurotransmitter like acetylcholine. We don't need to take that. But if you have enough folate or B12 in your diet, you don't need a supplement, and we can measure that in your blood. Some of the vitamins like E, D, K, and A build up in the body. They're fat soluble and they accumulate. We don't want that. And despite the good press that you occasionally see for coconut oil and ginseng, the proof of these being valuable for cognition is very limited. There are some things that are still being talked about and investigated. My favorite of these is cocoa, and it shows that there's a study going on now that's measuring whether a cup of cocoa every day can actually help with cognitive aging. It might. But also very important is omega-3 fatty acids. And one very large study of older adults showed that people who took omega-3 fatty acids or fish oil were less likely to develop cognitive decline. Once the decline is developed, that benefit did not seem to still obtain. What about alcohol? In the Mediterranean diet, we know that there's that recommendation for a glass of red wine every day. And for some people, that's a good thing. Resveratrol in the red wine is a powerful antioxidant. On the other hand, people who have the genetic predisposition that I mentioned before, the apolipoprotein E epsilon 4 gene, probably don't benefit from the alcohol. Now I'm going to talk about cognitive aging. I have some anagrams here, and cognitive stimulation. So the point I want to make here is that don't despair if you decide that you want to learn something new and get frustrated. Maybe you're thinking about taking up a musical instrument or learning a new language or figuring out some kind of a new skill, learning to work with woodwork. My father did that in his 70s and enjoyed it until his late 80s. New skills require the time and space and the effort to learn intentionally as we get older. It takes longer. You have to rehearse information. There are some mnemonic strategies like the method of loci and peg words that you may have heard about, and memory courses teach these. They do work. In fact, if there's a wonderful book called Moonwalking with Einstein that tells about a very normal person with a normal memory who becomes a memory champion by learning some of these strategies. We can make our memory better, but it's a lot of work. The most important thing is find a place with little distraction and enough time to learn new things. We can also exercise our brains. And this has been shown in mice and in men to be beneficial for the brain, both biologically by reducing amyloid pathology, but also by improving performance. We could teach memory strategies, we could teach other cognitive skills, or we could use computers. And in one study that was called the ACTIVE study for advanced cognitive training for independent and vital elderly, that study went on for 10 years. But at the very beginning, the people who participated, almost 3,000 participants who were older adults with normal cognition, they had a very, very small dose of cognitive training, only 10 sessions. The sessions were a couple hours, and they included either memory training, strategy training, or problem solving training that had to do with like analogies, or processing speed, which was a computer game, or no training. And 10 years later, the people who trained in processing speed and reasoning, but not so much memory, still had benefits that were noticeable and demonstrable in their activities of daily living and how they felt about their cognitive functioning. The computer game that was used in that study is part of a website called Brain HQ. So that's one of the cognitive exercise websites that I do like. But in general, there are a lot of cognitive training exercises that are available on computers. And I'll tell you what I like about them is that while you're playing with the computer's also playing with you. It's watching you. It's making things more difficult if you're doing too well. And it's making things easier if you're messing up. So it keeps you at a kind of an optimal level of success, which is both encouraging and reassuring, and also more beneficial because you don't get stressed. But the big problem with computer exercises is, number one, does it generalize? I'd like a computer game that's not only fun and entertaining, but also helps me figure out better where I parked my car or hung my keys. And I'd also like it to work even if I don't play the computer game for a few days. And so that's called generalization of effects and persistence of effects. And unfortunately, most of the studies have not shown great generalization or persistence. Most of the computer games do what they call training to a task. In other words, you get better at doing the thing that you practiced in the game. The best games teach you to think faster or to recall things that have occurred recently, what they call end-back training. And computers can be very beneficial in that way. Besides Brain HQ, there's also the website called Lumosity. Lumosity got in some trouble for false advertising a few years ago, but Lumosity and Brain HQ both offer very beneficial exercises, which are fun and easily available. And we shouldn't get too concerned about those advertising claims and throw out the baby with the bathwater. There's a lot of good in it. We just have to not expect more than they actually can offer. And along those lines, we should keep in mind the advice from an expert consensus that took place about 6 years ago with experts from Stanford University and the Max Planck Institute in Germany. And what they said is, remember that when you're playing a computer game, you're not spending time walking your dog, playing with your grandchildren, being with your partner, reading a book, doing other things that also are good for your brain. It's important to balance your activity and think about the whole picture. There's an opportunity cost of cognitive games. It's also important to prioritize, as I mentioned before, physical activity. So one of the things about computer games is that they aren't necessarily social. You can sit at a computer and play a game by yourself. But some computer games really are very social. For example, some of you might play Words with Friends or other games that are multi-user games that involve a direct competition, sometimes with a good friend of yours or a family member who you can also chat with about the game or on the phone at some later time. And that's combining cognitive activity with the social dimension. I'm going to talk next about social dimension. I should mention my favorite social game is a jigsaw puzzle, which people can do together, and it's a lot of fun. Okay. So this is just word scrambles. Key to optimal cognitive aging, social engagement. Here we go, social engagement. So it turns out that isolation not only makes us feel bad, it actually affects our bodies. There was a study of dental students done where they volunteered to have a little sore put in the roof of their mouth. And the ones who had good social networks healed faster. This is consistent with other findings in animals and people that show that isolation is a risk factor for health decline. It's about similar in its amount of risk to smoking. So isolation increases the risk for breast cancer in women, for infection or inflammation. It increases the risk for arthritis, diabetes, and heart disease. And people who've had cardiac surgery do less well when they're isolated afterwards. So getting socially engaged is being shown in a variety of research studies to affect the body's metabolism in a very positive way. One of the important things about social engagement is that it's linked with what's called active coping. Active coping is when we take charge of our problems and do something about it instead of just passively bearing the suffering. Now, in some situations, of course, people can't do that, but there are a lot of situations. This is what cognitive therapy and DBT help us understand, is that there are many situations where we have convinced ourselves that we're helpless, but really could take steps to improve matters. And social engagement encourages that. And let's face it, we know that when we present our problems to a friend, one of the things they'll tell us is that we should do something about it. Okay. Social media is one form of social engagement. And there's been some research that suggests that people who spend a lot of time on Facebook or other social media might be more depressed. And I think there's some truth to that for some people. But there's also opposing research, which I think is very important to pay attention to, that shows that older adults who surf the web actually activate areas of their brain that help them problem solve. And older adults who spend time on Facebook, LinkedIn, and other social media benefit from the social engagement, especially if they're using it in a positive way. For example, posting likes, sending messages, sharing things. One of my patients loves to send me funny pictures of animals, and they cheer me up, but I think it also really cheers her up to share something that she knows will connect with her doctor. Okay, next I'm going to talk about relaxation. And relaxation is something we may not think about as an active as an activity, but relaxation includes not only taking time to meditate, but also some active relaxations like martial arts, Tai Chi, yoga. There are a number of other things. There are some interesting studies that show that yoga and meditation actually help cognitive functioning, and meditation actually increases the size of the cortical areas of the brain that are involved in problem solving. So it's very worthwhile to find and cultivate some kind of a practice of relaxation or meditation. And finally, I'm going to talk about sleep. Now, I'm a terrible meditator. Usually when I meditate, I fall asleep, and that's not the best use of meditation. But sleep itself is actually a very important thing for the brain. One of the areas of research that's very exciting now is looking at the brain's immune system. In the body, we have the lymphatic system, which helps us fight infections and eliminate certain kinds of toxic infectious waste products. And it was thought until some years ago that the brain didn't have that, but in fact it does. And it's called the glymphatic system now. And the glymphatic system bathes the brain and cleanses it in cerebrospinal fluid at night when we're in slow wave deep sleep. If we don't get into that deep level of sleep, we don't have that benefit. Here's successful sleep. Older adults typically have sleep problems. Think about the men who need to get up to urinate, or anybody who has pain from arthritis or other conditions that makes them waken more easily. Or older adults often say that they spend more time in bed, but sleep more shallowly and feel less rested, drowsier during the day, and require a nap. That's very typical. But when people don't sleep well, there are a number of consequences. They have trouble paying attention, they're slower to respond, they have more trouble getting through the day and doing what they need to do. They're more depressed and anxious. They have more cognitive difficulty, greater risk of falls and pain. Actually, they're at greater risk for institutionalization, and they enjoy things less. So I noticed that I have increased cognitive decline twice there. Must be very important, but that's the topic of this talk. So chronic sleep deprivation also increases the risk of Alzheimer's disease. As I mentioned, the glymphatic system doesn't get to cleanse the brain of the beta amyloid that causes Alzheimer's disease. And you can wake people up in the night and show that they have increased amyloid in the morning, or you can let them sleep better and show a lower level. Now, just a couple of weeks ago, an interesting study came out in the Journal of the American Medical Association that showed that there's probably an optimal level of sleep for cognition, and that people who sleep around 7 or 8, 6 to 8 hours per night are likely to have less cognitive decline. Okay, sleep is a long talk on its own, and there are many things that interfere with sleep and many things that help sleep. But I'm just going to mention that there are important primary sleep disorders like apnea and REM behavior disorder. Apnea is when you stop breathing in your sleep, which is terrible for your brain and heart. REM behavior disorder is when you jump in your sleep during your dreams. Medications can help or interfere with sleep. Medical conditions, likewise. Of course, people who are stressed don't sleep well, or depressed, and people who have bad sleep habits don't sleep well. And then various psychiatric conditions interfere with sleep as well. So one of the things that we can all easily address is sleep hygiene, which is making sure that you have a good place to sleep that's quiet and dark. Don't have the TV on all night. Associate your bed with sleep. Don't watch a murder mystery right before you go to bed. Establish a regular routine for bedtime. Avoid napping, excess caffeine. Don't exercise right before bedtime. And don't eat just before you go to sleep. Everybody wants to know about sleeping pills. Are they good? No. In general, sleeping pills indicate that there's a problem that you need to address in a different way. Sleeping pills induce dependence and tolerance. You need more of them over time. They have side effects that we don't want, including cognitive side effects. So much better to work on sleep hygiene. And in fact, in older adults, there's studies that show that cognitive behavior therapy works better and has longer lasting effects than sleeping pills. Let me say that there are some people who require sleeping pills, but in general, it's not the ideal solution. So if we put all these things together that I've talked about, again, they spell the dancer's model of cognitive aging prevention. And there is a study in the United States, sorry, it was done in Finland, called the finger study. The US pointer study is a lot like the Finnish finger study. In the finger study, a group of people had a program very much like dancers, which included memory training, executive function training, disease management and attention to vascular risks, physical activity, good diet counseling, and social engagement. And after 2 years, their cognitive decline was significantly less than people who weren't in that program. Around the world, and certainly in the United States, we're seeing the beginning of brain fitness clubs, like the Beth Israel Deaconess Medical Center Brain Fit Club, where people can go and take advantage of these kinds of things, get nutritional counseling, take a Tai Chi class, work on a computer, get advice about sleep, meditation, and so on. And these may prove to be very valuable. We need more research. That's why the US pointer study is so important. Some people ask me about smart drugs. What can I take that'll improve my thinking? And sure enough, if you're taking a test and you have caffeine right before you take the test, that can probably help a little bit. An energy drink with sugar and caffeine can probably help a little bit for the very short term. There's a rebound effect and there's a long-term downside, which is very important. Over time, the use of things like energy drinks and stimulants, when they're not medically indicated, can create dependence and other side effects that are not good. In the future, we may have cognitive enhancement drugs, but we really don't now. What we have now is the disease management, physical activity, nutrition, cognitive stimulation, social engagement, relaxation, and sleep advice that I've given you, which the World Health Organization endorses and which has helped many people. And the World Health Organization, meanwhile, also just recently added some risk factors. They said air pollution, head injury, hearing loss are other important things that we should think about. Now, we have about 10 minutes here for questions and discussion, and I'm very interested in hearing your reactions and engaging with you. If you have ideas or thoughts you want to talk about or questions about what I've said. So I'm going to open this back up. I'm going to stop the screen sharing and return things to Amanda here.
Great. Well, thank you so much, Dr. Ellison. That was a wonderful presentation. Like Dr. Ellison said, if you have any questions, make sure to put them in the chat box so that we can try and address them. We do have about 10 minutes. We want to make sure we can get to as many as possible. So one person sent in a question that says, is there any research on like stress, like long-term cumulative stress on someone's cognitive functioning? And are there ways to address that maybe later in life?
Great question. And there's a whole body of research that's examining the relationship of stress and especially post-traumatic stress disorder to cognitive decline. There is some evidence that the stress hormone response to stressful events or a series of stressful events has long-term effects on brain health, including shrinkage of the hippocampi and effects on memory and cognition. And I would say there are a number of things that we can do to address that, including sending somebody with post-traumatic stress disorder to some of the helpful psychotherapies like DBT, EMDR, CBT, that are really designed to teach a person the cognitive skills for their own stress reduction.
Great, thank you. Someone else had a question. If you would suggest kind of a starting point, like maybe 1 to 2 things that would really be beneficial if you're just kind of trying to get a handle on this to start out, what would those maybe be?
Very important thing to think about. Obviously, we can't do everything all at once. So I would say if you're going to start with one thing or two things, let's say, get enough sleep. That's a low-hanging fruit, in my opinion, and try to build a regular exercise program into your lifestyle. If I were going to add then a couple other things, I would say make sure that you get medical care if you have things like diabetes, high blood pressure, obesity, sleep problems. Make sure that you talk to your doctor about treating those, and watch your diet. So that would be number 1 and 2, and then number 3 and 4.
Great, thank you for that answer. Someone else had the question, how can we make sure somewhere like an elderly care, like a retirement home, or like a elderly care facility is doing a lot of these things or encouraging these things in their clients? Is there any suggestion on that?
About, I think something like, how many people? There are 83 long-term care facilities in Delaware alone. And I think they average maybe about 100 people. So there are about 8,000 people in long-term care in Delaware, I believe. Now, one of the things that I think is most important to make sure that people get the kind of care that's going to be healthiest is visit them. Make sure that you visit them. And when you visit, take a walk with them, or bring them a healthy snack, or just talk to whoever is working with them, an activity director at the program. Make sure that they're getting encouraged to join in activities and so on. But in my experience, the people who have advocates and visitors are especially prone to be looked after well. And so I'd think about that. Don't isolate them, go and visit them. Now, in these days of the pandemic, of course, that's more difficult. But even so, window visits, Zoom visits can still continue, and checking up with somebody at the facility to get a status report periodically, just to make it clear that you care about the person and you're involved.
Great, it's great advice. Someone has the question, is there any evidence of increased rates of dementia for those with autoimmune disorders? If so, how much more likely are they to develop dementia?
Well, that's an interesting question. I'm not expert on the answer to that, but I can tell you that there are certain autoimmune disorders like temporal arteritis, or they sometimes call it giant cell arteritis, where there's vasculitis in the brain, and clearly a change in cognitive function is one of the early and prominent signs of that. There are other autoimmune diseases like lupus, where cerebral vasculitis or inflammation of the brain blood vessels is also prominent, and we see cognitive symptoms sometimes, but not always. Then there are probably other autoimmune diseases where it's less common. I haven't heard of it with rheumatoid arthritis, for example. But in general, I would say that the autoimmune disease is going to be a small additional risk. Not one of the major factors for most of them, but very important to take care of because of its effects on the system in general.
Great, thank you. The next question we had is, can you speak to the socioeconomic influences and aging condition?
Absolutely, that's so important. One of the things that we're hearing a lot about now are healthcare disparities. We know that the African American population and the Hispanic American population are more prone to develop dementia. African Americans twice as frequent as white Americans, and Hispanic Americans 1.5 times. And it's been shown that the risk factors, which can relate to poor quality air, education, and nutrition, resulting in also less access to first-rate medical care, can start to manifest themselves even in young adulthood and lead to later cognitive decline risks being increased. So absolutely, socioeconomic influences are very, very important factors. And the Swank Center is actually trying to address this. We have a public education program for lifestyle and cognitive aging, which we now are providing by Zoom. And we have these community screenings that are voluntary. And we're particularly setting as a goal for this coming year to make ourselves more available to populations with healthcare disparities.
That's great. That's great to hear. Someone asked, as a caregiver, where do you suggest finding reputable and good resources to kind of help educate themselves or help their family and loved ones?
Well, I think the Alzheimer's Association has a very, very good website. The Alzheimer Foundation of America, AFA, also has a good website. So those are two very good places to start, and they're free and readily accessible. That's where I would start.
Great. And then it looks like this is the last question. Oh, here we go. There's another one popped up. So the next question is, how can we make sure that there's an increase in research surrounding these issues? And is there ways for people to get involved who are not necessarily researchers to encourage more research in this area?
Absolutely, and such a timely question, because the Walk for Memory of the Alzheimer's Association is taking place very soon. Check on the Alzheimer's Association website and volunteer to walk. I don't know how much of it is going to be actual and how much of it is going to be virtual this year, but there's a memory walk every year that brings this issue to the public's attention. And in addition, I think November is Alzheimer's disease month, but it might, I think it's November. But there is a month every year that's devoted to increasing Alzheimer's awareness. In Delaware, we have the Greater Delaware Valley chapter of the Alzheimer's Association, which is very active. And if you want to volunteer or get involved, look on their website, which you can get through the national website. You can get connected to them. And so those are a number of things you can do. You can also make sure that your state representative and senator understand that this is an important issue to you, that we live in a country where about 16% of the population are elderly. And in Delaware, we're an older state. About 18% of the population are 65 and older. It's a retirement state for some people. And so it's very important that we address these issues.
Wonderful, thank you. So this is the last question. I think we have a couple more minutes here. Yep. Someone said, you mentioned sleep aids can be harmful. How harmful is something like Benadryl in cognitive?
Well, thanks for mentioning Benadryl, which is the brand name for the generic antihistamine called diphenhydramine. Diphenhydramine is in many medications that you get over the counter, like Tylenol PM or other sleep aids. It's an antihistaminic drug, and it gets into the brain, which is why it makes you sleepy. There are a lot of other antihistamines that are used for motion sickness or other things. And the problem with the anticholinergic and antihistamine drugs is they have definitely been shown to put a burden on your ability to respond to cognitive challenge. So I would definitely try and get not dependent on Benadryl or diphenhydramine. If it's something that you take 25 milligrams once a week, no big deal. But if a person is taking, it every night or taking 50 to 100 milligrams to fall asleep, that's not good for you.
Great. Well, thank you so much again, Dr. Ellison. This was a wonderful presentation. Just for all of the participants to know, this was recorded and will be up on NAMI Delaware website for 30 days post-conference. So you can review it there, go back. Again, we appreciate you taking the time out of your day to help educate everyone. And we hope everyone has a great rest of their day.
Thank you all for your attention. It was a pleasure joining you this morning.
Wonderful.